Acupuncture is great therapy for any type of nerve pain. Hi, I'm Dr. Gibbons with Acupuncture and Wellness of Pensacola, and today I want to talk to you about acupuncture, why acupuncture is such an effective treatment for nerve disorders, specifically peripheral neuropathy, trigeminal neuralgia, Bell's palsy, and shingles-related nerve pain. If you or someone you love is dealing with burning, tingling, electric shock pain, facial weakness, or even persistent nerve irritation, this is important to understand because nerve pain behaves completely different than muscle pain, and it has to be treated differently. So why is nerve pain so different? Nerves are different than muscles, as we know. When a nerve is irritated, compressed, inflamed, damaged, it doesn't just hurt, it misfires. It's angry. It sends distorted signals. That's when you get the burning, tingling, numbness, electrical shock sensations, hypersensitivity to light touch, and muscle weakness or facial drooping. Conventional treatment often focuses on suppressing the signal, like using medications like gabapentin or neurotonin. But acupuncture takes a different approach. It works to regulate, restore, and support the nervous system itself. So when people ask me how acupuncture helps nerve disorders like peripheral neuropathy, like trigeminal neuralgia, Bell's palsy, or post-shingles nerve pain, I break it down into three main mechanisms. It's not theory, it's physiology. So one, neurochemical modulation, calming overactive pain signals. First, acupuncture changes the chemistry of the nervous system. When the needles are placed strategically, they stimulate your body to release natural chemicals like endorphins and other regulatory neurotransmitters that calm down pain pathways. In conditions like peripheral neuropathy or trigeminal neuralgia, the nerves are often firing too much, too loudly, or in distorted patterns. So acupuncture helps to regulate and calm down that signaling. Instead of constant irritation or electrical shock type pain, we're encouraging the nervous system to quiet down and reset. So number two, it improves blood flow to feed the nerve. It improves circulation. So nerves are living tissue. They require oxygen. They require nutrients. They require healthy blood flow in order to repair. So when circulation is compromised, whether from diabetes, chemotherapy, inflammation, shingles, or physical compression, the nerve doesn't function properly. And acupuncture increases the microcirculation around those affected areas. That means better nutrients, more oxygen to the stressed or damaged nerves. And when you improve the environment around the nerve, healing becomes more possible. So number three, neuroplasticity. This is the third mechanism. Your nervous system is adaptable. It can reorganize, it can change, but after injury or chronic irritation, it can get stuck in a dysfunctional pattern. Acupuncture provides controlled stimulation in specific nerve pathways. That input encourages the brain and peripheral nerves to remap. That's why in Bell's palsy, we often see progressive return of muscle function. And in chronic neuropathy or post-herpetic neuralgia, patients often report gradual improvement in sensation and decreased pain intensity over just a few treatments. We are not just suppressing the symptoms, we are influencing how the nervous system behaves and communicates with each other. So we see a lot of patients here at Acupuncture and Wellness of Pensacola with peripheral neuropathy. Peripheral neuropathy is one of the most common nerve conditions that we treat. Common symptoms are burning feet, numb toes, pins and needles, poor balance. Sometimes I have patients that say, I'm walking on sandpaper, or they have cold or wet sensations in their legs and feet. Common causes, of course, include diabetes or chemotherapy, and sometimes something we just don't know how it's caused is idiopathic. So what we want to do is reduce the inflammation around the nerve endings, improve blood flow, and support the nerve signaling regulation. So many patients notice improvements in pain first, then gradual changes in sensation and balance. Another common and extremely pain nerve disorder we see is trigeminal neuralgia. It affects the trigeminal nerve and it is very, very painful for our patients. This condition causes sudden electrical stabbing pain triggered by talking, brushing teeth, chewing, or even just a breeze. I have patients that even are afraid of showering to get it on the face to activate the pain. Acupuncture helps with calming the nerves and getting more circulation to those nerve branches. So many patients experience decreased frequency of these pain attacks after a few treatments. Another common patient that we see is someone with Bell's palsy, and that's inflammation of the facial nerve, and it leads to sudden weakness or paralysis. It almost looks like a stroke has happened. So acupuncture reduces the inflammation, it improves nerve conduction, and it supports the muscle reactivation. So the droop is significantly less. When started early, acupuncture can significantly improve the timelines and have more of improvement. So the earlier we start, the better. And lastly, I want to talk about shingles and post-herpetic nerve neuralgia. Even after the rash, the shingles rash is gone, the nerve remains very irritated and it's very painful, even though there's nothing there on the skin. Acupuncture helps calm that chronic irritation, improve circulation to the damaged nerve, and reduces the sensitivity. This is particularly important because post-shingles nerve pain can become long-lasting if not addressed properly. And patients can be on many meds that don't even touch the pain.